my name is Haylin Smith, and this is my informative speech about the career of a family nurse practitioner. What led you to choose your future career? For me, I started to pray for God to lead me in the direction of a career that gave me joy and fulfillment while I also got to help others. That's what led me to wanting to be a family nurse practitioner. Here are 3 things that a family nurse practitioner gets to do. 1, they get to care for patients of all ages, they get fulfillment in their everyday work, and they get to practice more advanced medical skills. The first thing I want to talk about is how they get to care for all ages. When you first become a family nurse practitioner, you may not understand where you best fit in with what age. Getting to work with different ages every day is going to give you a better understanding of this. Also, it's going to enable you to make a better professional impact. Some professions you can only work with babies, children, or adults. Getting to work with all ages allows you to make an impact on every generation. Also, it's going to give you a different understanding of emotional maturity. The way you have to approach a child is going to be much different than how you have to approach an adult. So over time in this role, your emotional maturity is going to change. This is going to help you be an overall better person and an overall caregiver. The next thing about this role is the fulfillment that it brings. You get to diagnose and treat patients. When someone is hurting and needing answers, you get to be that person for them. RNjournal.com states, they play a critical role in managing chronic conditions such as diabetes, hypertension, and asthma, helping patients maintain optimal health and prevent complications. As a family nurse practitioner, you'll get to work with people who may have long-term diagnoses and disabilities. You get to be the one that's with them throughout every step of the way and help them. Also, there will be sometimes you'll have a child who comes in that you get to help, and they stay with you all throughout their adult life. Having someone trust you with their medical care for that long is always going to be rewarding. The last thing I want to talk about is the advanced skills you get to use as a family nurse practitioner. Research.com states, programs train students in medication management and pharmacology, equipping them to prescribe and monitor medications responsibly while understanding drug interaction and patient responses. As a family nurse practitioner, when someone comes in, you get to diagnose them, come up with a long-term or short-term treatment plan, and then prescribe them the medication. Registered nurses do not get to do this. Although this is a bigger responsibility, it also gives you the opportunity to make a bigger medical impact in someone's life. So, in conclusion, the 3 things we talked about today are: family nurse practitioners get to care for all ages, they have a fulfilling role, and they get to practice more advanced skills. These are just a few reasons why I have chose this for my future career. And I hope this speech has impacted you when you choose your career to find something that you find joy and fulfillment in every day. Thank you.